Hello, I'm Dr. Greg Walker, a physician with Cincinnati Children's Sports Medicine and Orthopedics. This is the 5th module in this education series developed for youth coaches. In this module, we'll review neck and spinal cord injuries. Objectives. At the end of this module, you should be able to 1. Understand the anatomy of the spine and the neck and the seriousness of injuries to this part of the body. 2. Know whether the spine should be immobilized. 4 signs to remember. 3. How to immobilize the spine of an athlete with a suspected spinal cord injury. 4. How to assess and maintain the airway in preparation for EMS arrival. Objective 1. Understand the anatomy of the spine in the neck and the gravity of injuries to this part of the body. The spine within the neck, or cervical spine, is made up of 7 small vertebrae that are at highest risk of injury due to their small size and range of motion compared to the rest of the spine. The spinal cord lies within a canal inside these vertebrae. Injuries happen to the spine when forces compress these bones together. The most observable example of the force that causes this injury is the spearheaded tackle in football, which happens when a player tackles leading with the crown of his helmet. This creates a buckling of the spine, which can result in spinal cord injury. Ligament or bone damage in the cervical spine can cause instability of the spinal canal, causing damage to the spinal cord, which can result in paralysis or death. Objective 2. Know whether the spine should be immobilized. 4 signs to remember. There are 4 signs you should assess for spinal cord damage in an injured athlete: consciousness, mobility and sensation, pain, and deformity. 1. Check the athlete's level of consciousness. See if they can follow your commands. Do they know where they are? Do they know their own name? Do they know the day of the week? Are they opening their eyes on their own without being asked to? Or do they open their eyes in response to verbal commands or pain? Number 2, ask them to gently try to move their fingers, toes, arms, legs. Ask them if they feel any tingling or numbness anywhere. Tingling, numbness, weakness, or inability to move are important signs of nerve injury. Number 3, ask them if their neck hurts. You don't have to feel, touch, or press their neck to check for pain. Number 4, look at their neck to check for any obvious deformity. If any of these signs exist, call 911 immediately. Objective 3, immobilize the spine of an athlete with a suspected spinal cord injury. If you suspect a cervical spinal cord injury, the most important thing to do is immobilize the athlete's spine to prevent further injury to the spinal cord. Take these steps. Number 1, cup your hands behind the head, placing 2 fingers behind the ear on the bony portion of the skull, with thumbs pointing toward the athlete's face. Number 2, do not apply traction to the neck because it could result in further injury. Number 3, maintain a neutral alignment of the head and neck. The athlete's head should not be flexed, extended, or rotated in either direction. Any of these movements of the head could result in further injury. Number 4, if the athlete is wearing a helmet and/or pads, keep them on to maintain neutral alignment. Objective 4, assess and maintain an injured athlete's airway and stabilize until EMS arrives. It is important to ensure the airway is easily accessible after a cervical spine injury. Number 1, in sports with face masks, football, lacrosse, hockey, and others, remove the face mask. Do not remove the helmet, as we noted before, to prevent loss of neutral alignment. Number 2, if the athlete is having trouble breathing, attempt to push the jaw forward without moving the neck to prevent further injury. Number 3, maintain the above steps until EMS arrives and takes over. Review of objectives. To review, we've covered the anatomy of the cervical spine, how to assess an injured athlete to determine the presence of a cervical spine injury, how to immobilize the spine, and how to maintain the athlete's airway until EMS arrives. I'm Dr. Greg Walker from Cincinnati Children's Sports Medicine and Orthopedics, and I thank you for your attention to these important tips and for your involvement in youth sports.